Well, most likely you've scrolled social media, seen doctors offering tips and tricks and hacks on staying healthy, the best vitamins, what to eat, what to avoid. Well, a Miami doctor is warning about what she calls the fatal misconception.
And so mis and disinformation is spreading faster, 7 times faster. 70% of retweets are often fake news as opposed to facts. So what we have to be mindful of is that mis and disinformation is traveling fast, namely because we have new technologies, and the consumer needs a partner in their care. It's very important to have a doctor long before you're in an emergency room.
Dr. Geeta Nayyar is a local rheumatologist, and she felt compelled to write a book to address the toll that misinformation is taking on not only our health, but doctors and the healthcare industry. Dr. G, as she's referred to, says she first saw the power of misinformation and disinformation during the height of the HIV/AIDS epidemic in the 1980s. As a medical resident, she saw patients who were coming into the practice. They were sick because they were misinformed about how one would contract AIDS or HIV. Fast forward to the COVID pandemic. She says she saw it unfold all over again.
We made this life-saving vaccine, and then no one was convinced or understood the science enough to take it. And that's very solvable. I mean, if there's one silver lining of the pandemic, we should walk away to say, hey, you know what? We've got to invest in communicating science in a simple, relatable, and approachable way.
Dr. G says the COVID pandemic underscored the importance of healthcare. She says patients have the responsibility to validate what we're consuming on social media. Is the source selling a product? What is the source's incentive? Healthcare providers have a duty to ensure trust so people can come to them with questions and concerns. And there should be a regulatory component. That is what a solution looks like here. Dr. G's book is called Dead Wrong: Diagnosing and Treating Healthcare's Misinformation Illness. And that was the book cover there. By the way, with artificial intelligence, information is just going to keep coming at us very rapidly. She encourages people to A, have a doctor, B, to ask them about anything that you might read online, because they know your kidney function, your genetic component, and they can make the best recommendation for you. Let's talk about